Hello, everybody. Today we have something that is really a very important issue for us to talk about, but I don't want to use the word celebrate, but to acknowledge the month of overdose awareness in our country and in actually the entire world. We have with us a couple of real experts who we want to talk about what's going on in the area of treatment for addiction and availability of treatment, et cetera. So with us today, we have Cassidy Lekan, who is the VP at Transitions, which is a key provider of services in Northern Kentucky, and Dr. Teresa Koeller, who is the addictionologist and really is working with journeys and treatment every day. So really, thank you both for your service, and also thanks for talking with me for a couple minutes today.
Thank you.
Thank you, Judge.
Well, if I can, Doctor, let's start with you for a moment. You've now been dealing with patients for years now, and maybe you could give us an update on where Journeys is as an organization and availability of treatment today, if loved ones or family or coworkers are in the midst of needing help.
Okay, thank you. So Journeys, we actually started in 2015 through St. Elizabeth Physicians and St. Elizabeth Healthcare. At that time, it was just a very small endeavor. It was me. I had a nurse and a medical assistant. Since that time, we have grown and moved into a new facility, which we're actually kind of bulging at the seams now as well. We now have 4 full-time providers, 2 nurse practitioners, a board-certified addiction specialist in psychiatry, and also 3 board-certified physicians in addiction, along with, I think, 8 therapists, 8 case managers, 5 peer support specialists, and then all of the medical staff that we need to run this endeavor. As far as availability, we can get patients in within usually that day or the next day. We take our referrals from the community. We take them from the hospital, from the local recovery centers, and gosh, anybody who needs treatment can get into our facility for treatment.
Again, just a key improvement over really the years that you've now been doing this, which is you've seen this huge improvement of availability of treatment and hopefully outcomes as well.
Right. So we work to partner with community programs to help patients not only with their recovery, but with the areas in their life that improve as they go through recovery. So we work with Life Learning Center to help patients find jobs and get education, work with them to help with felonies. It's endless: dental, primary care, and then also we've got the new Lift Up grant. I don't know if you're familiar with that, but we partner with Northern Kentucky Workforce Investment Board, the Life Learning Center, Northern Kentucky Career Center, Brighton Center, to help patients when they get out of jail, or if they're just in the community and need assistance with jobs and education and help with their, getting rid of felonies, which are a real impediment to finding a good job. We have a Baby Steps program that started in 2015 as a collaboration between St. Elizabeth Healthcare and St. Elizabeth Physicians. And through that program, we work with pregnant and parenting women to help them along their journey of recovery. We have on the hospital side, we have 3 nurse case managers, 3 peer support specialists, and then we have 2 therapists, and then our physicians also at Journey make up the rest of that team. And we've had some really great results with having moms be able to parent their babies. So oftentimes when moms go through our program, babies go home with moms, and they're better equipped to handle the newborns and the family life and the other kids. So it's pretty exciting what we've been able to do and move forward with.
And I know you wish it wasn't needed, but obviously it is today. And the purpose of us chatting also is just simple awareness that overdoses are still happening at a high rate, even though there's a service available through you all and many other agencies and organizations. I'm going to come back to you in a moment, but let's talk, Cassidy, for a second about Transitions. That availability of treatment. We don't want anyone to lose their life. We want to make sure that people have a pathway to success and for themselves and their family. But talk about really where we are right now with Transitions and availability there.
Yeah, so Transitions has been around over 50 years. In the last 3 years, we've made a lot of great advancements at the organization. Specifically in December of 2018, we opened the Residential Treatment Center. And I think the primary goal of opening this center was to really address the need and the immediate need for treatment. Unfortunately, we had wait lists for individuals that were trying to get into whether it was a withdrawal management program or a residential treatment program. And we know that sometimes the window of opportunity is so small. And when a person takes the courage to reach out and say, I need help and I need to get into treatment, whatever that might be, we wanted to make ourselves available so that people could come in right away and immediately. And I think we've been able to do that at the Residential Treatment Center, just having walk-in availability every single day. One thing that we definitely try to do is, even if it's something that we can address, we partner with St. Elizabeth's and Sun Behavioral and all the other partners in the community to say, here's what we believe your plan to be, and let's get you connected to the right resources. But the building itself is very large, but it was intended to be that way so that there is always a bed available. It's been interesting over the last few years. We don't hear it as much, but we still used to get calls, do you have a bed available? And I think we finally have gotten to the point where we can say, you don't have to ask that question anymore. There's always a bed, and just come on in. So we've been able to really address that here at Transitions, and then continue to offer more than just residential, which I think is so critical to a person's recovery. Residential is truly designed for stabilization, to get the disease of addiction that's very active, get it stabilized, get a person, get a new foundation set, and identify what's going to happen when a person leaves treatment. Intensive outpatient, recovery housing, seeking employment, some of the similar things that Dr. Koeller said, is that residential oftentimes is that first step, and what happens when a person leaves is so critical. And the plan needs to be individualized. It needs to be tailored to what the person needs, and there needs to be so much support and encouragement around them as a person gets into early recovery, where a return to use can be very high at that time. So the more support, the more structure, the more programming and treatment that we can give a person when they transition into outpatient after residential treatment is so imperative.
Absolutely. Well, and obviously there's a lot of things we're not going to talk about here this morning or today, but whether it be prevention or law enforcement and all those things. But let's go back to you, Dr. Koeller, for a moment, because I think that the point is once you have a patient who is dealing with a disease of addiction, and if they, whether it be calling through our hotline, which we'll put on here, that can direct individuals to hopefully their first level of maybe just a detox or what have you. The whole idea of treatment, it can either be therapy, it can be medically assisted. It seems like for the first time in a long time, everybody's kind of being aware that both of them are needed, both the medically assisted and the continued therapy. And talk a bit about that as well.
So typically when someone calls us or comes in for an appointment, they're first assessed by the therapist, and based on that, they are determined to have a certain level of care based on the American Society of Addiction Medicine, or the ACM criteria. And then they'll see a medical provider to assist with the needs. So we do follow the Hazelden Betty Ford Foundation Core 12 model of treatment, which combines 12-step facilitated therapy along with medication. And we went through training for that probably somewhere around 2014-15. And we've partnered with Hazelden Betty Ford ever since to do that. So to kind of follow a patient along, what they'll do is they'll first come in and have an orientation with the case manager. They'll see a therapist, and then they'll see a medical provider. And at that point, it'll be determined, do they need detox? Do they need residential? Can we accommodate them in the outpatient setting? Are they already on medication? If so, then we determine, is that appropriate dose, or does something need to be changed? If they're not on medication yet, then we have an induction suite where we start patients on agonist therapy, which would be your buprenorphine, naloxone, also known as Suboxone or Zubsolv. And that process takes 2 days. So they come in the morning, and we have an induction suite with nice, comfortable chairs. They meet with the peer support specialist during that time. They meet with the case manager. They go to a couple of groups. We have lunch for them, and we get them started on medication. So it's a safe way to start medicine, because one of the things that you worry about is if they're not in withdrawal, or if they're not in enough withdrawal, they could potentially go through precipitated withdrawal as we start the medication. So what we're trying to prevent is precipitated withdrawal, and also to sort of fine tune what dose they're going to need of the buprenorphine naloxone. They also at that time are given a sample of Narcan that we've gotten through several grants, and also training so that they know how to use the Narcan.
And that's
even if
obviously,
patients,
and that's
oh,
just
absolutely.
That's just a note to make sure people realize that they've heard Narcan is to save someone's life at the moment of overdosing, correct?
Correct. And, some patients will say, well, I don't need that. I'm not going to use anymore. And that may be the case, but
Sure.
they might, or they might have a family member, or they may be in a group of people and somebody overdoses. So to have that Narcan on hand not only helps save their lives, but maybe somebody around them. So I think the more that we can distribute that into the community, the better. And we have made a concerted effort to give all of our new patients Narcan. We check every time they come in for a visit if they have it, and if they don't have a Narcan, we have samples. So they go through training and they get a sample of Narcan at that time too.
And it's if I for one have it and carry it, so I've never had to use it in an emergency, but maybe that'll keep me from having to do it. But
yes, like an umbrella.
Yep, exactly.
Yeah.
Well, let's let me go to you, Cassie, for a moment, if it's okay, doctor. I want to just chat about the issue of, there's a process that when they get into beginning treatment with maybe on your team, Dr. Koeller, but when the issue today, if we realize there's unbelievable amount of overdose still, we know addiction is still a major, really, we talked about it before the word pandemic was on our minds because of COVID. The epidemic of addiction still destroys our country, really. But the stigma of it, and I have a good friend of mine asked me, well, what does this mean about a stigma? Why does that matter? My answer, by the way, was the simple fact that we realize everybody has a challenge, and we don't want to keep someone from getting help because they're afraid of acknowledging the addiction that they have, or maybe not even realize that they have it. That's a layman's explanation. Tell me where that's correct, or make a better clarification. What is stigma all about, and why do we not need to have it?
Yeah, I think what you said is that stigma prevents people from reaching out is probably the simplest way. There's a lot of negative connotation with the disease of addiction. Some people still believe, if a person could just stop, why? I don't understand why they can't stop. So I think there's a lack of education around the disease model of addiction. And the reality is all of us know someone, whether it's in our close personal family or extended family or friends that does have the disease of addiction. And so if we can create more language around it and awareness, and one of the biggest things that we use at Transitions is all person-centered language. So this is a person who has a substance use disorder. This is a person who has depression, acknowledging people first and the disorders or diseases that they have. I also think that education from parents to children, that this is a disease, there's a genetic predisposition to it, giving children the knowledge of what that looks like and what that might mean for them if addiction does run in their family, for them to have a closer look and just be aware of it and the why behind
Sure.
it, so they can decide what choices that they want to make initially throughout their adolescent, teenage, or young adult. But ultimately, I think the stigma prevents individuals from reaching out. It's a very difficult call to make or to walk in to a treatment center. So how you treat people, how you teach people about addiction, how you interact can make such a difference in those that right now are hesitant to come in, or feeling isolated, or feeling like treatment doesn't work, giving them the opportunity to say, come in because it does. Recovery is possible. Treatment does work. So I think that's the most important thing I could share.
Well, and as we wrap up, because we could talk about so many areas, the whys, your thoughts about the future, because we're still sitting in this moment of really unprecedented overdoses really across the board. And if I go back to you, Dr. Koeller, for a moment, if there was one thing you would share, what you've learned now that you've been in this battle on a daily basis, that you wish that the community would know, that you see every day and you think it's a misunderstanding, what would that be?
Gosh, I don't know that there's just one thing, but as Cassie said, treatment is possible. But it's through treatment and acknowledging that you have the disease of addiction that we can start to heal people. And it's not just healing the people, it's their entire families. We have families that have been torn apart by addiction. We have people that can't find jobs. We have people that have no self-worth, that just go on in life as if, they're just waiting to die. Treatment fixes that. Treatment and loving, caring, understanding helps change lives and make people whole again. And that's really why we do that, why I do that, because what I've seen is families healed. I've seen people gain self-respect. It's an amazing process. And unfortunately, there is the stigma. I had a lady the other day who can't find a job because she has an old felony that was from when she was using. It was 5 years ago. She said to me, Dr. Koeller, I'm a different person now. But every time I try to find a job, that theft charge comes back that happened while she was using, and we do change people. It's phenomenal. The moms that are parenting, the dads that have their kids back, the people that do find jobs and have self-worth. That's why we do this.
Thank God you all are doing it. In the nearly, whether it be 1,500, 1,600, almost 2,000, depending upon the year of overdoses, you think about it, the lives that then are behind those numbers, to your point. But the good news is, you think about all the agencies, all the available beds, the available treatment today that exists, that should be a sign to say we've got tens and tens of thousands of people who are rooting for individuals to be successful. So, and thanks for what you're doing. Cassidy, if you had one other thing you've seen now in your tenure so far that you really wish people would know about, and when they look at what's going on to reduce overdoses and keep this aware in our community.
Yeah, I think, just always remembering that this is a disease. And I just would reiterate everything that Dr. Koeller said, is that, again, treatment is available and treatment does work. I think we're very fortunate in Northern Kentucky because the access to treatment is there, and reminding people that you can get better and you can heal and you can recover. And there's a lot of people behind you that are rooting for you. And I just can't reiterate the same thing, that to see people start to smile again and feel better and reconnect with their families is the most rewarding experience of this position. But I would really just highlight everything that Dr. Koeller said, because it's all very true, and treatment does work. Recovery is possible.
Well said, and a way to wrap it up. It's Doctor, you have another comment there?
Yeah, there was one other thing that I was supposed to talk about. So in addition, there's a couple of, sometimes people aren't ready for treatment, but they still need a safe way to use. And so that's why there's the syringe access programs, because ultimately we also want to prevent debilitating disease that will affect people for the rest of their lives, such as HIV and hepatitis. And so that's the role of the syringe access, along with sort of reeling people in to get them to understand that maybe there is treatment. And so that when they're ready, they can then move forward with treatment. And then the other thing too, two things actually, is if you have a loved one and you're concerned that they need treatment, there is the availability to get them into treatment through Casey's Law. So Casey's Law provides for the basically forcing someone into treatment who's an adult, if there's a better way to say that.
That's true. Great.
So, because sometimes when you're in the throes of using, you don't make good decisions. You can't see that there's another choice. And so using Casey's Law allows somebody to get a loved one into treatment. And so hopefully that will spur them on to recovery down the road. And then finally, the PEACE program, or the PEACE group, actually is a group. It stands for People Enduring Addiction Consequences Every Day. And it's a support group for anyone who has experienced the loss of a loved one to addiction. But really what we're hoping is to ultimately end the consequences of addiction and end overdoses. So it's a lofty
Absolutely.
ideal, but
Well,
hopefully
you
we keep
want to work
working towards
yourself
it.
out of a job.
That would be a good thing.
Yeah. Well, that's a great recap. It's available. The treatment's available. There's places for those who have lost. You're talking about the peace support group. Casey's Law is available. Local attorneys know about that, but also, I believe, to your point, I think actually Northern Kentucky actually has more Casey Law cases than anything in the state, I believe. So that means more lives are probably being saved by that available law. And then to your all's point, just the availability of therapy, medically assisted. There's teams available to help individuals find the right path for them and set them on a lifetime, hopefully, of success. Well, thank you both for your time, and again, thanks on behalf of the entire community for what you do every day. You're amazing.
Thank you.
Thank you.